leading research center in the field. Before I begin, I would like to acknowledge that CAMH is situated on lands that have been occupied by First Nations for millennia. Lands rich in civilizations with knowledge of medicine, architecture, technology, and extensive trade routes throughout the Americas. In 1860, the site of CAMH appeared in the Colonial Records Office of the British Crown as the council grounds of the Mississaugas of New Credit, as they were known at the time. Today, Toronto is covered by the Toronto Purchase Treaty Number 13 of 1805 with the Mississaugas of the Credit. Toronto is now home to a vast diversity of First Nations, Inuit, and Métis who enrich this city. CAMH is committed to reconciliation. We will honor the land through programs and places that reflect and respect its heritage. We will embrace the healing traditions of the ancestors and weave them into our caring practices. We will create new relationships and partnerships with First Nations, Inuit, and Métis, and share the land and protect it for future generations. I'm very pleased to welcome the Parliamentary Secretary to the Minister of Health and Member of Parliament for Milton, Adam van Koeverden. Adam, we're thrilled to have you here, especially to talk about such an important topic as supporting autistic people and their families. We're gathered this morning in our Crisis and Critical Care building, which opened almost 2 years ago as part of our third phase of redevelopment. This beautiful new building, which houses our state-of-the-art emergency department, provides the best in crisis and complex mental health and addictions care, and integrates CAMH with our surrounding community. Many in that community have been deeply impacted by the COVID-19 pandemic, and this is certainly true for autistic adults and their families. Unpredictably, disruptions of routines and limited access to needed help and social care have put a tremendous amount of stress on people in these communities who were already experiencing extreme challenges navigating timely mental health supports well before the pandemic. So working together with autistic adults and their families to co-design and deliver programs to support mental health is important to CAMH. I'm looking forward to continuing to work with our federal government partners to build a world that embraces all groups in our community and is accessible for everyone based on their unique needs. Now, it's my pleasure to introduce Adam van Koeverden to provide details about today's exciting announcement. Thank you. Secretary.
Thank you, Sarah. I guess the time between speakers requires a little bit more patience than usual, but good morning, everyone, and thank you very much for being here for today's announcement. And thank you to President Downey for your introduction and for meeting me on the campus today, and introducing me to so many clinicians, advocates, caregivers, and people with great insight. I'd like to first begin by thanking Sarah for the land acknowledgement, and also acknowledge that the land that we're here and gathered on today is traditional territory for many First Nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and that Toronto is covered by Treaty 13 with the Mississaugas of the Credit First Nation. It's really nice to be here with everyone today, and I hope everybody had a good Thanksgiving. Thanks especially to the Center for Addiction and Mental Health for hosting us here today in this beautiful new building, and this is very remarkable. I was looking at some of the art earlier and some of the older pieces, including the stairwell. It's really just remarkable how CAMH has encapsulated both history and the future for this incredible asset for the city and province. It's a privilege to spend time here at this teaching hospital and this research center. You know better than anyone that the need for mental health and substance use supports have never been higher as we continue to cope with the aftermath and the ongoing challenges of the COVID-19 pandemic. We here in the Greater Toronto Area are extremely fortunate that we all get to call this city home. I want to thank you for everything that you do to promote and support mental health in this community and across the country. The pandemic has been a really stressful and life-altering experience for many of us. There's no doubt that some communities have struggled more than others, including autistic individuals, their families, and their caregivers. While lockdowns and school closures left many of us scrambling, autistic individuals and their families were cut off from many essential supports, such as therapeutic and recreational programs. This lack of access to critical services translated into social isolation, postponed appointments, increased stress, and deteriorating mental health for both those individuals and their families and caregivers. And there's no doubt that we continue to feel the shockwaves of this disruption to these services, and will probably continue to feel them for years to come. Recognizing this, the Government of Canada is supporting projects that address the negative impacts of the pandemic, specifically for autistic individuals and their families. And so, on behalf of the Honourable Jean-Yves Duclos, Minister of Health, I'm proud to announce that the Government of Canada is providing more than $460,000 to the Centre for Addiction and Mental Health for its new project, Coping with COVID. Through this project, CAMH will set up online forums for autistic adults and their families. These forums will provide a virtual space to make connections and provide mutual support. This peer support is an important antidote to the stress and social isolation experienced by many in the autism community throughout the COVID-19 pandemic and still do today. Autistic individuals should not face additional barriers when it comes to cultivating social connections and having access to services that are critical for their health and their well-being. That's why we want to make that support as easy as possible to access. I'd also like to acknowledge that similar announcements like this are happening throughout the GTA. I've got a couple of colleagues that are very focused on the autism file and folks with autism and their families. So there are about 6 or 7 projects like this currently being announced, and it's all part of a $9 million commitment from Budget 2018. I'd like to close today by thanking each and every one of you who have met today for your feedback, for your commitment, and for your ongoing support in ensuring that autistic individuals and their communities and caregivers have the knowledge, the tools, and the connections they need to thrive every day to reach their full potential. This project will go a long way toward putting those resources into the hands of those who need them. And I have no doubt that it will make a real difference in many lives, including some of those that are here today. Thank you for your work. Thank you for your support. And thank you for having me today. Cheers, everyone.
Thank you very much. This is very exciting. And it's my great pleasure to introduce Dr. Yona Lunsky. He's the director of the Azrieli Adult Neurodevelopmental Center at CAMH, a senior scientist in the Adult Neurodevelopment and Geriatric Psychiatry Division, and director of the Healthcare Access Research and Developmental Disabilities Program called HCARD, who will be able to speak to us about the impact of this funding announcement today. Dr. Lunsky.
Thank you, Sarah, and thank you, Parliamentary Secretary Van Koeverden. This funding comes to us at a terribly important time. The pandemic has impacted all of us in many ways, as we know, but it's been particularly detrimental to autistic people and their families, as well as people with other neurodevelopmental conditions. It's exacerbated pre-existing issues, and it's added to new problems. Indeed, our research has shown that adults in Ontario with developmental disabilities were more than 2 times as likely to be hospitalized and to die from COVID than the other adults in our province. What people may not be aware of is that in addition to that, they were also much more likely to visit emergency departments and to be hospitalized, particularly for mental health reasons, than the general population. When I say this is a mental health crisis, and it is a mental health crisis, it's important to understand that this is not a problem inherent in autistic people. It's a crisis in mental health care delivery because we have gaps that are only growing wider with time. As one of our advisors says, as we age in the wilderness without services. Living in a society that is not accepting, understanding, or supportive affects how many autistic people see themselves and their families and their lives. They have higher rates of mental health issues combined with a much harder time accessing timely and autistic-informed mental health services. Without being able to get the mental health care that they need, combined with glaring gaps in education, in employment, in housing, and in healthcare generally, leaves them and their families, again, in the words of one of our advisors, collectively continuing to fall through the cracks, which is now a canyon. The funding that our program has received from the Public Health Agency of Canada is not on its own a solution to this mental health crisis, but it allows us to do something differently, something that is often missing, that is a crucial component to promoting autistic mental health and supporting the mental health of families. We're working together with autistic adults and with family caregivers of autistic adults to co-design and to support their leadership in delivering mental health supports. Building off of the evidence that we have and collecting new evidence as we go, we're able to explore new ways of working together. This will include monthly autistic-led webinars and a Lunch and Unlearn series for families. We're also expanding some of the work that we've been doing in the areas of mindfulness and in ACT, or acceptance and commitment training, where we have people with lived experience co-leading and delivering this work. And we're building peer connections in the form of virtual coffee chats for family caregivers and autistic-led peer support groups. Now, if we want to get this right, we need to not only pay people with lived experience to guide this work, but we also need to put supports and the necessary accommodations in place so they can do this well. So after many months of learning and planning together, we're preparing to launch a number of activities for Canadian autistic adults and their families this fall, all virtual across Canada, and we hope that these activities and the related mental health resources will be available widely. We'll evaluate what we do so that we can learn how to do it better, and we appreciate that this is a vital step, one step, towards improving mental health for a grossly underserved community.
Thank you, Dr. Lunsky. I think nobody tells it better than you do. So I think I want to thank participants who came here today to join this important announcement. Welcome to CAMH into this beautiful facility. Thank you, Parliamentary Secretary Van Koeverden, for your time with us today. And now I will hand it over to Dominic Carullo, who will take the media questions for us. Thank you.
We will now proceed to questions from journalists in the room. Please state your name, media outlet, and whom your question is directed to. You will have the opportunity to ask one question with one follow-up. Let's proceed to the first question. Nous allons maintenant passer aux questions des journalistes présents dans la salle. Veuillez indiquer votre nom, votre média et le destinataire de votre question. Vous aurez la possibilité de poser une question avec un suivi. Nous allons passer à la première question. There's no questions in the room. We're going to head over to the online moderator.
Thank you, Dominic. So we will now proceed to questions from journalists on Zoom. If you are a reporter and you wish to ask a question, please use the raise your hand function. We ask that you limit yourself to one question and one follow-up. Nous allons maintenant prendre des questions des journalistes sur Zoom. Si vous êtes des journalistes et vous désirez de poser une question, veuillez utiliser l'option de lever la main. Alors, je vais donner quelques instants ici. I'm just going to give it a couple seconds here to see if we have any questions. Okay, Dominic, it looks like I'll turn it back over to you in the room.
That concludes today's event. Thank you. Ceci conclut l'enregistrement d'aujourd'hui. Merci.